Place the PRP tube in the tube rack next to the counterbalance. Carefully fill the counterbalance with water to the same level as the blood in the PRP tube. It is helpful to perform this step with a syringe for accuracy, as water can be easily added or removed until precisely leveled. It is important the two tubes are balanced to the exact same level, as the slightest imbalance could cause the centrifuge to rattle, vibrate, or not spin properly, all of which may lead to tube breakage. Once the tubes are properly balanced, place the PRP tube and the counterbalance directly across from each other in the centrifuge. Place the tubes inside the tube holders and cover using the clear caps. These tubes must be balanced within the centrifuge or the centrifuge will not spin properly. If the cap over the counterbalance tube is not attaching properly to the tube holder, remove the counterbalance from the centrifuge and use a hypodermic needle to vent the pressure. Puncture the needle into the rubber stopper of the counterbalance while firmly pressing down on the stopper. Once the stopper is secure, remove the hypodermic needle and place the counterbalance tube back in the designated tube holder. Reapply the cap and secure tightly. Before closing the lid and starting the spin cycle, ensure there are no loose or foreign parts inside the centrifuge. Remove all extra parts, including unused tube inserts or caps. This will help ensure the centrifuge is properly balanced and reduce the risk for tube breakage. Once the centrifuge is properly balanced, close the lid until it is secure. Before starting the spin cycle, verify the settings, such as RPM, time, and break speed, are correct for the centrifuge you have. Press the Start button on the centrifuge. The spin cycle is now beginning. Verify that the speed is accelerating and there are no excessive vibrations or noise. Verify the centrifuge reaches the predetermined RPM and time starts counting down from 10 minutes. Excessive vibrations or noise is the result of an imbalanced centrifuge. Press Stop and rebalance the centrifuge if an imbalance occurs. Once the centrifuge completes the 10-minute cycle, the lid should automatically unlock and open. Lift the lid and carefully remove the PRP tube from the centrifuge. Avoid agitating the tube, as it may result in temporary resuspension of platelets and/or platelet activation.